Hi, I'm Dr. Macklin Guzman, Chief Science Officer with Medi-Weightloss Corporate Headquarters. I'm a clinical epidemiologist by training, and I oversee research and development at Medi-Weightloss as part of the Medical Affairs Department. Obesity medicine is constantly evolving, and therefore so is the scientific research. Therefore, it is important for us to gather clinical data on our patients as well as population-based data in order to support and augment the clinical decision-making of our practitioners in order to develop evidence-based guidelines. PROMIS, which stands for Prospective Metabolic Indicator Study, is Medi-Weightloss's landmark study, which included a multi-center trial of 5 clinics throughout the country. It followed 479 patients for a year and measured the impact of the program or the intervention on metabolic syndrome and its key indicators or risk factors. In order to be diagnosed with metabolic syndrome, a patient needs 3 out of the 5 risk factors. What we were able to determine in additional findings was that approximately 1 in 10 patients screened positively for all 5 of the risk factors. And then at approximately 2 in 10 screened positive for 4 of the metabolic syndrome risk factors. And approximately 3 in 10 screened positive for 3 of the metabolic syndrome risk factors. The biggest findings of the PROMIS trial were that 52% of patients presented with metabolic syndrome, or 1 in 2 do not know that they have it. The Medi-Weightloss program decreased the prevalence of MEDAS by almost half within 13 weeks of the program. Patients lost approximately 30 pounds in 3 months and 55 pounds in 6 months. Patients were also able to reduce their initial starting body weight by 14% in the first 3 months of the program and by 21% by 6 months of the program. Patients were also able to reduce their BMI by 5 points in the first 3 months of the program and almost by 8 points by first year. Patients were also able to decrease their body fat percentage by 12% in the first 3 months of the program as well. Patients decreased waist circumference by almost 5 inches after 3 months. Specifically, females lost 5 inches and men lost 8 inches. Clinical research based on individual clinical data for patients allows us to answer very important research questions that ultimately will inform the clinical decision-making of our practitioners. The findings of the PROMIS clinical trial have been published within the Journal of Public Health through Oxford University Press as of December 2019.